Welcome back to FCC Knows Mental Health. Welcome back to FCC Knows Mental Health, and I'm your host, Shaquille Jackson, with my other two hosts,
Kelly Rosser.
And I'm Maya.
And today's topic for this video is back to school transition as well as suicide prevention.
So as you guys know, kids are transitioning back to school and things may be a little different from previous school years. So we have some tips that will help you as parents and possibly your kids. So the most important one is to take care of yourself to ensure that you're modeling healthy behavior. And the saying is you can't take care of others if you're not taking care of yourself. And also, build relationships with the teachers or other personnel at the school to make them aware of any type of problems that are going on, or if your child is having a difficult time transitioning back to school. Have an age-appropriate conversation with your children about how things may be different, whether it be the cancellation of extracurricular activities, as well as what they can do to keep themselves or others safe, whether it be hand washing or wearing masks, whatever you think is appropriate for your family. And it also is a conversation of focusing on things they can control versus things they can't control. So right now a lot is uncertain and up in the air about the pandemic and things that are going on surrounding public health, but reassure them there are some things that you are doing at home with your family where you can control how they're feeling. And it's an important conversation where you can the saying is to name your fears so you can tame your fears. So if they're feeling scared about anything, be sure to set the stage and have an open conversation with them where they can address any concerns or questions they have about how things may be different. And lastly, establish a routine with your kids so they can know what to expect, whether it's like another school year or it be different. You guys have anything to add?
Pretty much covered it.
Great.
We can all help prevent suicide. Each year, the Lifeline and other mental health organizations and individuals across the U.S. and around the world raise awareness of suicide prevention during September, National Suicide Prevention Month. National Suicide Prevention Month is celebrated during the month of September. All month, mental health advocates, prevention organizations, survivors, allies, and community members unite to promote suicide prevention awareness. National Suicide Prevention Week is the Monday through Sunday surrounding World Suicide Prevention Day. It's a time to share resources and stories as well as promote suicide prevention awareness. World Suicide Prevention Day is celebrated on September 10th. It's a time to remember those affected by suicide, to raise awareness, and to focus efforts on directing treatment to those who need it the most.
Hey there, so talking about suicide prevention this month, I'm going to present some facts for you guys. And these are just facts to kind of highlight the individual impact as well as family impact and impact on our society that comes with suicide. So 78% of all people who die by suicide are actually male. Although more women than men attempt suicide, men are nearly 4 times more likely to die by suicide. Suicide is the second leading cause of death among people aged 10 to 34 and the 10th leading cause of death overall in the U.S. And so, as Maya was saying, especially as kids are transitioning back into school, kids younger and younger ages are being more at risk of suicide, especially during the time in our society right now. The overall suicide rate in the U.S. has increased by 35% since 1999, so it's a lot more prevalent nowadays. 46% of people who die by suicide had a diagnosed mental health condition. And then while half of individuals who die by suicide have a diagnosed mental health condition, research shows that 90% experienced symptoms. So just being aware during this time and knowing the signs in your family members when people are starting to have suicidal ideation, depressive symptoms. It's not often as visible from the outside, but just checking in with your children, with your loved ones, especially, during this time as we're coming out of a pandemic. People might be struggling more. And then as far as the community impact, annual prevalence of serious thoughts of suicide by U.S. demographic group. So 4.8% of all adults, 11.8% of young adults age 18 through 25, 18.8% of high school students, so that's one of the highest percentages, and then 46.8% of lesbian, gay, and bisexual high school students, so they're at a higher risk of suicide. And then I have some resources as well. So we're filming in Georgia, so we wanted to provide that Georgia crisis line for you guys. It'll also be down in the notes for you guys as well. It's going to be 1-800-715-4225. And then, of course, if you're in an immediate crisis, we do recommend calling 911 if it's an emergency. We also have the National Suicide Prevention Line, which will also be listed for you guys. It's going to be 800-273-8255.
Of course, thank you, Maya, as well as Kelly, for providing those facts and also those tips for, getting your school back, getting your children back into school, that transition from being online to in the classroom again, and also the facts about suicide and just being mindful of these things, especially when it's concerning your own family and your own friends. So I have a few tips here, being that you may have this person in your life, and to be able to identify it, and even if you can't identify it, be comfortable and confident enough to ask the question. And of course, the number one thing us counselors say, don't beat around the bush, don't sugarcoat it. It's best to just ask straight up what's going on, just so they'll be comfortable enough to be like, okay, they're actually asking me and not treating me as if I'm a child or if I'm below them or any type of degrading way, but it's you having that concern from that family member or for that friend. So the first hashtag, be the one to ask. Research shows people who are having thoughts of suicide feel relief when someone asks after them in a caring way. Findings suggest acknowledging and talking about suicide may reduce rather than increase suicidal ideation. Some people just need that time to sit down and talk, being that you may be parents of children and you're working, you have your busy schedules, but it doesn't hurt to find 5 to 10 minutes out of your day to sit down with your child and just to see what's going on through their head, because a lot of times your children may be smiling in 1 minute and then the next minute they're thinking about other things. And it's good to be safe than sorry, and to sit down and have this talk with your children, especially appropriate depending on age-wise, but still straight to the point. Be the one to be there. Individuals are more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful after speaking to someone who listens without judgment. A lot of these individuals who do have these suicidal ideations or who have attempted suicide and it was a failure, even that they still feel like a failure even after the attempt. So it's just being cautious of the tone you're speaking with them, the words that you're saying, that it's not coming off judgmental, but coming off as if you care and it's genuine. And it's easy to take whether you're being genuine or you're interrogating. So also be mindful of the questions that you ask. Some questions can be very invasive and some questions can be very vague at the same time. But depending on who you're talking to and depending on how the relationship is, depends on how that conversation is going to flow and if there's a trust in that relationship. Be the one to keep them safe. A number of studies have indicated that when the lethal means are made less available or less deadly, suicide rates by that method decline, and frequently suicide rates overall decline. So prescription medicines, a lot of people overdose on taking a whole bunch of pills. If you are one who have these high dosage prescriptions, make sure they're locked away in a safe place to where the person has no access to it, even access to the keys to get to it, because sometimes you can lock a cabinet and you can put the keys somewhere and they can still find it and still have access to it. And those who are permitted to carry firearms, as long as they're locked up in a safe place where they're not accessible, it helps lessen and decrease the thoughts of suicidal ideation or just the act in itself. So being mindful of what's around, like what is any type of method that could be used for them to attempt suicide. Be the one to help them stay connected. Studies indicate that helping someone at risk create a network of resources and individuals for support and safety can help them take positive action and reduce feelings of hopelessness. Here at the Family Center, we like to emphasize having that social support, and that's just social support with your counselor, social support with your family, with friends, support groups, help groups, those hotlines. That's also a means of a social support because you're having that human interaction and you're having someone to talk to. But to emphasize these things, to get them included in activities that get their minds off of what's really bothering them and what's boggling them down. And also be the one to follow up. Studies have also shown that brief, low-cost intervention and supportive ongoing contact may be an important part of suicide prevention, especially for individuals after they have been discharged from hospitals or care services. Now, we're not saying be overly protective or overbearing or constantly breathing down their neck, because that doesn't really help the situation. That just makes them resist even the more. But being able to check in once in a while, like every few days, or just to see how they're doing. Hey, how are you doing? A text message can go a long way to some people, or just a phone call. Some people even like to receive letters this day, but seeing that you are taking that time out to reach out to them to see how they're doing mentally means a lot to people, especially here at the counseling center. We really do emphasize, following up with our clients, seeing how they're doing, especially if there was missed appointments or things like that. We like to check in to see how are you guys doing, and being that this is a family or a friend, it would mean even that much more to them, because now they have a feeling of a sense that you see them, you're hearing them, and they're not just being pushed to the side or being neglected.
Yeah, and just going off of that as well, we are in Suicide Awareness Prevention Month. Just not being afraid to talk about it. The more that we bring awareness to it, the more that we break down the stigma, a lot of guilt and shame surrounding this topic. Especially people who have attempted suicide and have not completed suicide. There is a lot of guilt and shame. Culturally, a lot of families, they prefer to not talk about it. They prefer to just kind of forget that it happened because of the pain associated. But people who have attempted suicide not necessarily need that. Sometimes they need to talk about it. Sometimes they need to know that it's okay, So just continuing to bring awareness and not being afraid to talk about difficult topics.
Share anything?
I think the support piece stands out to me because sometimes it's difficult to reach out and go to a counselor sometimes for people. So sometimes if you're there as a friend or a family member and you don't necessarily have to have the conversation all the time, but just being present and around them and available to them when they need you can be helpful for them.
Right, absolutely.
All right, so thank you all for listening to us and sharing this topic with us, because they're both important topics to have, especially with the back to school transition as well as suicide. And suicide rates are pretty high when it comes to children, especially school age children, and we just want to be that and put out that awareness that these things are prevalent and they are still real to this day and they should be taken seriously. So thank you, and we'll see you guys next time. If FCC knows mental health.
Thank you.